Well, Dr. Bauschka, thank you for taking the time today to talk with me about the paper that you helped publish. Can you tell us a little bit about why you and the team elected to write this paper and kind of what the purpose of it was?
Sure. So, I wrote this paper while I was over at ACUTE, and we have such a unique population there of patients with eating disorders who are on a medical stabilization unit for severe complications of their malnutrition. And knowing that often these patients present in hospitals around the country and around the world, where there are physicians who have less experience in seeing this particular patient population, how can we share what we've learned about what the medical complications of severe restrictive eating disorders are and what they are not, so that we can provide our colleagues, especially in psychiatry, with that information so that as they see these patients on potentially a less frequent basis, and have less of a comfort level treating these patients, that they have some information to use to sort of look at what's going on medically and what's going on psychiatrically. There was also the thought that, as physicians, we get very little training in eating disorders, right? So I got an
Right.
hour in medical school, and then I had very limited experience in residency. And really, what I've learned about eating disorders has been on the job by working at an eating disorder treatment center. And most of our colleagues don't have the benefit of that experience and knowledge. And so, our obligation as experts in the field of eating disorders to really share what we know about this patient population so that the patients get better care and the providers who are treating them feel more comfortable in providing them with those interventions.
And of these patients that you reported in the article, are there common medical complications that you wanted to make sure that psychiatrists and families of those patients are aware of?
So wanted to really look at lab abnormalities that are common and also that are not common, because what we also don't want to have happen is that someone with an eating disorder presents to a hospital and everything is attributed to their eating disorder. So for example, as patients become more and more malnourished, they undergo what's called gelatinous marrow transformation of their bone marrow. And so their bone marrow essentially stops producing all of the cell lines. So they become anemic, they have low red blood cells, they have low white blood cells, they have low platelets. If you were to see a patient in your hospital with low red blood cells and low platelets, but they have normal white blood cells or even elevated white blood cells, you wouldn't want to assume that that's normal or part of their eating disorder. You would want to be looking for an infection. And so, really trying to tease out what is typical when someone is malnourished as a result of a restrictive eating disorder, and what do you need to actually pay more attention to, and what do you need to medically work up.
Dr. Bauschka, can you tell me why do you feel it's your responsibility to contribute to advancing the science of taking care of these patients?
So I think we are so uniquely positioned as providers, particularly at ERC Pathlight and at ACUTE, to know a lot about this patient population that most other folks see minimally or not at all in their careers. And I think we have such a responsibility to these patients and to their families and to our colleagues who are out there with less resources than we have and less expertise and sort of experience than we have, to really continue to advance the science, but also share what we know, whether it's through research or through educational presentations. We really have such an obligation. We're so lucky to know what we know. And I do think that we owe it to our patients and their families and sort of everyone else who might come into contact with them to really advance that science and keep those conversations going.
Can you tell me what you think the big message of this paper is?
I think the main goal was to share information with people who don't typically treat folks with eating disorders. What we know, what's the latest science, what are their medical complications, what are the most likely psychiatric complications they'll see, so that, we really share the knowledge that we have with everyone else.
Well, Dr. Bauschka, thank you so much for taking the time. I'm really excited that this paper has been published, and I'm really hopeful that it's going to help educate a lot of clinicians across the country to help take care of a lot of patients in need. So thank you for you and your team's efforts.
Thank you, Dr. Weeks.